Hi, Miss Throck. I'm Dr. Snyder. The nurses told me that you've been feeling pretty bad recently. Let me know what's been going on.
I really have been feeling bad. I just had a baby last week and I'm feeling terrible. My legs are swelling, I have no energy, my chest hurts. This morning I coughed up blood.
Wow, that sounds pretty horrible. So, shortness of breath, coughing up blood, kind of feeling bad all over, and leg swelling?
Yes.
Anything else bothering you, like having a high fever?
I don't know about a fever. I feel like I can't breathe. I'm worried I'm getting pneumonia.
Oh, really? Are you having chest pain as well?
It does hurt when I breathe, yes.
So when you take a deep breath, you have pain?
Yes.
All right. Well, I'm glad you came in. Those sounds like symptoms you shouldn't be ignoring. Now, you just said you had a baby about 8 days ago?
Yes.
All right. Well, then tell me, did you have a vaginal delivery or was it a C-section?
I had a C-section.
Were there any complications?
Oh, I forgot to tell you. For some reason, I couldn't get the stitches to close, so I have to keep this wound vac on my stomach for the next couple of weeks.
Oh, okay. Was there an infection?
No, they just couldn't get the stitches to close.
Okay. All right. Well, we're going to take a look at you head to toe and see if we can figure out what's going on. So first things first. Now tell me about your legs. You said your legs have been swollen, right?
They have. They were swollen for my entire pregnancy, but they got bigger after the surgery.
Okay.
Then for the first 3 days, it looked like they were getting better, but then 5 days ago, they started swelling, and now they're really hurting.
Okay. Now, when I'm squeezing your legs, is that hurting you?
Yes. Definitely worse, yes.
Does it seem like one leg is worse than the other?
My right leg is worse.
All right, take a big breath for me. And then another. All right. All right, we're going to take a look at your wound back here. All right. All right, Ms. Throck. Well, those symptoms are a little concerning to me. I think we should check you for pneumonia and also make sure that there's nothing else going on. So, Erin, can we go ahead and get CBC, Chem 7, an EKG? We'll also get a chest X-ray, and we're going to go ahead and do a CT pulmonary angiogram. She does have some tachycardia right now, so I think she's at moderate risk. And we'll get that figured out and get you taken care of.
Okay, I'll put in those orders.
Okay.
Dr. Snyder, CT center back, she can't lay flat.
Really? Ms. Throck, tell me what's going on.
It's so much worse. I just can't breathe. Please don't make me go back in there. I can't breathe.
Okay, is the pain bothering you? We're going to get you on the heart monitor here.
No, I just feel like I can't breathe. It's worse when I lay down.
Okay. All right. Well, I'm sorry you're feeling so bad, and I apologize. I was just looking at your EKG here. We're gonna get you something to make you feel better. In the meantime, Erin, can we go ahead and start her on 500,000 unit bolus of heparin and start a heparin drip for presumed pulmonary embolism? And let's give her 0.5 milligrams of IV Ativan now. And then just let's bring the other 1.5 milligrams over to CT. And let's go with her to the CT scanner and bring the airway equipment as well.
0.5 of Ativan, 500,000 of heparin. I'll get that out of the Pyxis.
No, 5,000 of heparin.
5,000.
In addition, 5,000 units of heparin. Also, go ahead and tell pharmacy to get Alteplase, get TPA out of the Pyxis. And let's just have it at the bedside. We are not administering it, but let's have it at the bedside.
Okay.
Now let's get back over there. All right, we're going to get you feeling better. We'll take care of this.
Okay.
Yeah, she looks pretty bad.
Dr. Snyder, I'm not sure I feel a pulse.
Start compressions. We need some help in here. Let's get the code card. Let RT know. We're setting her up for intubation. Give me a king airway.
Did you want to intubate her?
In a minute, not yet, just to give me the king.
There's not one in here. I'll have to go get it from the difficult airway.
All right, yeah,
part.
just continue compressions. Let pharmacy know to give the 50 milligrams of Alteplase now. IV
Okay.
push.
Okay.
Can you bag her?
Angela, get another tech in here. We're gonna need help with compressions.
Okay. That'll be another test.
You gotta switch.
Good.
Aaron, I'm going to take over for you.
Okay.
At 2 minutes.
There you go. Dr. Snyder was showing PEA on the monitor.
Let's give 1 milligram of epinephrine IV.
Okay.
As soon as I can get that king airway.
One milligram of epinephrine's going in.
Perfect. Thanks for bringing her in. Can you tell me what's going on with her?
We were dispatched to a sick call. She lives on the streets of Raleigh. When we found her, she was lethargic and septic looking. Her heart rate was 105. Her blood pressure was 80/60. Her sats were, as you can see, 84. They were in the mid 80s for us the whole time.
Okay, was that on oxygen or?
No, we didn't administer any oxygen.
Okay, all right. So has she had any drugs of any kind?
No, sir, we were unable to obtain any IV access.
Okay. Is she a hard stick?
Yeah, take a look at her arms here. She's got some track marks from obvious drug use.
Oh. All right. Now I can see what you're saying. Oh, well, thank you. Let's. Can I get a light here? All right. So she's got pinpoint pupils. Aaron, can I get 0.4 milligrams of IM Narcan and go ahead and bring 2.
I'll get it for you.
Thank you. Bring 2 milligrams, but let's just give her the 0.4 milligrams now.
0.4, got it.
And let's just go ahead and start bagging. Also, I'm going to need the IO drill if we can't get IV access. Actually, let's just go ahead and get it. Let's go ahead and get the IV. First the Narcan, then the IO drill.
All right, 0.4 of Narcan IM is in.
What the hell? Oh, my back. Where am I?
Oh.
Did you guys give me Narcan? I need pain medicine.
We did, Miss Brock. I'm Dr. Snyder. Can you tell me what happened to you? The paramedics said that you were unconscious.
Oh my God, I was in so much pain I had to shoot up for some relief.
So when you say shoot up, you mean you injected heroin?
Yes, I'm in pain. I'm in agony.
Okay, all right.
What the hell?
Your IO's in.
Thank you. So we're just giving you some medicines and we can take care of this pain, but you tell me a little bit more. When did you start hurting?
Oh, it started hurting last night. It got so bad. I called the ambulance. I waited and I waited and they didn't come.
Okay, well what's wrong? How long has the back been hurting? You said it started just last night?
Yes.
Is it on one side or the other?
It's all over.
Okay.
I hurt everywhere.
Now, have you had problems with back pain in the past?
No.
Okay, all right. Are you feeling sick otherwise, like having a fever?
No, sometimes. You gotta give me something for this pain.
We'll get you something. Aaron, can you just go ahead and give her 4 milligrams of IV morphine, or actually IO morphine? Are you feeling weak in your legs at all, or numb in your legs?
No, they just hurt all the time.
Okay, okay. Have you had any problems walking?
No, it just hurts to move.
Okay, all right. Well, let me take a look here. Can you do something for me? Push down real hard on my hands. Push down hard. Push down hard. All right, now I need you to push harder.
It hurts. It hurts to move.
Okay. What about the other one? Push down hard. Push down hard.
Oh, it hurts to move.
Okay.
4 milligrams of morphine IO.
All right.
Oh.
All right. So I'm gonna touch you on your legs here. Okay. Do you feel me touching you on your legs on the outside?
Yeah.
All right. Now which side am I touching you on? The left or on the right?
Right.
Okay. What about now?
Left.
Okay. I'm gonna touch your legs on the inside too. Do you feel me touching you here?
Yeah.
All right. Now listen. When I touch you with this instrument, tell me, does it feel sharp or dull?
Sharp.
Okay. Are you sure?
Dull.
Okay. All right. Well, listen. Have you had any problems peeing, going to the bathroom?
No more than usual.
Okay. What do you mean? Like sometimes you feel like you just can't urinate or peeing on yourself?
Well, sometimes it just burns on my piece, off and on. It's not all the time.
Okay. All right. I see that your arms are you got some track marks on your arm and they looked pretty tender. Are they hurting you a lot?
They hurt all the time.
Do they get red and swollen like you ever get a fever in them?
Well, sometimes.
Okay. All right. Well, listen. We're going to need to do a few things. With your back pain and then with this redness, I want to make sure that this is just regular back pain and nothing too serious. So let's go ahead and get some orders in her. Aaron, I'd like to do CBC, a complete metabolic panel. Let's send a SED rate, a CRP. Let's go ahead and draw up 10 of Valium IV, and let's get her over to MRI for a MRI of the T&L spine. She's got a really equivocal neurologic exam. And sometimes with the heroin, you can get infections, and we want to check for all that. Yeah, let's go ahead and get her over there, and we'll get this sorted out, all right?
All right.
Medical alert, code blue, MRI. Medical alert, code blue, MRI.
Angela, you get a code card?
Yep. Here's your bag.
I need this bed locked. Epinephrine, 1 milligram, IV now. Turn on the monitor, please.
Ready for your epi?
Yes.
All right, we've got IV in the left AC,
Here's the epi, 1 milligram.
1 milligram of epi.
Hey, Angela, what's going on with this young man?
Hey, Dr. Schneider, this is Brian Gimza. He's a 19-year-old with status asthmaticus. He's been using Nebs all night, no improvement.
I can't breathe. Breathe. Can't breathe.
All right, Mr. Gimza, I hear you. I'm Dr. Schneider. We're going to get you
Breathe.
feeling better.
Oh, help me. Help me. I can't breathe.
All right, just give it a try. Try to take a couple deep breaths.
Can't breathe.
All right, so Angela, he's got a near silent chest with some wheezing. Let's start him on 20 milligrams of albuterol continuous nebulizer. And let's go ahead and order up the BiPAP, as he may need that as well. We're going to get you feeling better. Don't worry.
Okay.
Help me.
Call respiratory.
Can't breathe.
Yeah, cold respiratory as well. All right. So, Mr. Gibbs, as we're getting the rest of that equipment in, I want to give you a little extra oxygen. And Angela, as soon as you're ready, let's switch him over to the BiPAP.
All right, I've got the BiPAP here.
And actually tell respiratory to, thank you, tell respiratory to go ahead
No,
and run the
take it
continuous.
off. I can't breathe.
And-
Take it
Oh, no, just
and,
take it
off.
just get,
Off.
get-
off. Take it off. Take it off. I can't breathe.
you can breathe, Mr. Gimza. This is going to help.
Take it off.
Thank you, Angela.
Sure.
Let's give him 30 milligrams of IV ketamine now.
30 milligrams of IV ketamine. Got it.
Just try to slow it down, Mr. Gimza. You're going to be all right.
That's me.
Let our team know that we may need to.
His 30 milligrams of ketamine is in.
How the stats doing?
A little flush. Still in the 70s.
All right, let's go ahead and we're going to go ahead and intubate him. Can you draw up another 150 milligrams? It's not helping. Let's get him another 150 milligrams of IV ketamine, and let's get rocuronium as well, 1 mg per kg.
Okay. 150 ketamine and rock, 1 mg per kg. All right. What would you like for me to give first? The ketamine?
Yes, but I'm not ready.
Okay.
Go ahead and give him a 2-liter normal saline bolus.
Okay.
Let chest x-ray know. We're going to need a chest x-ray as soon as this guy's intubated.
Okay.
And let's lay him back maybe another 15 degrees.
Sure. Say when?
We're good?
Okay.
And
I have your medications ready. You tell me what you want first.
I am ready, so let's give him 150 milligrams of IV ketamine.
You give it 150 milligrams of ketamine.
So he must be retaining because he's unconscious now. I'm sure that's just the CO2. I'm going to go ahead and switch him over to tracheal intubation. So can we clear that? Thank you.
Did you want me to give the rock yet?
Let me see if I can.
Okay.
In and let's get him back.
Okay.
All right. So our stats we got let's get a capnometer on there. Check for color change. What's going on with that rhythm?
So it looks like he's in a Brady at 19. Let me see if you have a pulse. You don't have oxygen going to your
All right,
mouth.
we're in. Check for pulse. No pulse.
No pulse.
Okay. All right. Someone else start compressions.
Okay.
Let's give 1 milligram of IV epinephrine.
Can I get some help in here?
All right. I'm going to see whether he's air stacking. Just push on his chest. Push on his chest. All right. Just continue compressions.
I've got 1 milligram of epinephrine ready to go.
Please administer it. IV epi.
One milligram of epi in, and flushing.
Pyxis?
No, 5,000 of heparin.
5,000.
In addition, 5,000 units of heparin. Also, go ahead and tell pharmacy to get Alteplase, get TPA
Okay.
out of Pyxis. And let's just have it at the bedside. We are not administering it, but let's have it at the bedside. Your heart's racing a little bit, and so what I'm going to do is I'm going to do a little ultrasound and take a look and see what's going on.
Okay.
Have you ever had any heart problems?
Not that I know of.
That's good. That's good. So this will also take a look and see how just how everything's working. I'm gonna try to keep you modest here, okay?
Okay, I don't have any modesty after having that baby.
All right, all right, all right. So, Ms. Trott, you're saying you never had any heart problems before, right?
No, I was absolutely healthy before I had the baby.
Okay, okay. Well, you know, sometimes during pregnancy, your heart can kind of be stressed by all the fluid changes, and so I'm going to have one of our cardiologists come see you and see if we can sort some of this out. All right?
Okay.
All right. Well, I'm going to get him on the phone call right now.
Hello.
Hey, Dr. Sinan, this is Graham Snyder. How are you?
I'm doing all right. How are you, Graham?
I'm doing well. I've got a lady that we're pretty worried about. I got a 31-year-old female who's about 8 days postpartum with what I suspect is a dilated cardiomyopathy. She looks like she's got an EF somewhere between 10 and 20%, but she's tachycardic, she's hypoxic, she's extremely symptomatic, and we'd like your team to see her immediately.
Yeah, that sounds good. We'll be right down, Graham.
All right, sounds good.
Yeah, Graham, I see what you're talking about there. Actually, I'm surprised she's doing as well as she is right now. We're going to take her immediately up to the cath lab for a balloon pump.
All right. Well, that sounds good. So, Ms. Strott, we're going to take you upstairs, going to do a little procedure, and see if we can get some of this shortness of breath to go away. Dr. Sin will take good care of you.
Okay, thank you.
Go ahead and draw up 10 of Valium IV, and let's get her over to MRI for a MRI of the T&L spine. All right, Miss Bethany, so we're going to send you over to get some of those tests to take a look at your back. But before we go over, I see your blood pressure's a little low, so we're just going to do a quick ultrasound, make sure you're not too dehydrated. All right. We'll try to keep you modest here.
I don't care.
All right. So that's your heart. That looks good. And all right. Hey, look like you might be a little bit dehydrated, so let's go ahead and give her 1 liter normal saline. So, Miss Bethany, you got a little extra fluid in your abdomen. Is there any chance that you could be pregnant?
Oh no, they said I couldn't get pregnant because I've had too many pelvic infections.
When you say pelvic infections, you mean like STDs, like gonorrhea?
Yeah.
Okay, all right. Well,
Get
that's
'em
no
all.
problem. Have you been hurt recently, like tripped and fell, or did anyone like punch you or hurt you in any way?
No.
No car crashes or anything?
No.
All right. Aaron, can you just go ahead and dip that urine for a urine pregnancy test?
Yep, I'll give it up.
All right, perfect. Yeah, so we're gonna go ahead and get that done, and let's just go ahead and add on a type and screen.
Okay.
So, Aaron, what did the dip show?
Positive HCG.
Okay. All right. Well, I gotta make some calls. Looks like you actually got a positive pregnancy test, so we're gonna have one of our obstetricians come down, see if we can sort out some of this fluid. Graham Snyder.
Hey, Graham. It's Dr. McDonald. How are you?
Hey, I'm doing well.
Hey, I just got looking at this ultrasound for Miss Bethany.
Mm-hmm.
Yeah, so she's got a complex right lower quadrant mass. With that much fluid and these vital signs, is a positive pregnancy test. We're presuming it's ectopic, and I think we're going to take her to the OR right now.
All right, sounds good. I appreciate you seeing her.
Yes, sir. I'll talk to you later.
Take care.
Oh, help me. Help me. I can't breathe.
All right, just give it a try. Try to take a couple deep breaths.
Can't breathe.
All right, so he's got a near silent chest with some wheezing. Let's start him on 20 milligrams of albuterol continuous nebulizer. And let's go ahead and order up the BiPAP, as he may need that as well. We're going to get you feeling better. Don't worry.
Help me.
All right, well, I'm going to just do a quick ultrasound, see what's going on here. All right, looks good. Normal sliding. He's got no lung sliding. So stats at 79%, no lung sliding. We're gonna go ahead and decompress his chest. I need a long 14 gauge, and then get me a Pleurovac chest tube
Okay,
and a thoracostomy kit.
got it.
All right. And we'll get another 100 milligrams of ketamine IV, please.
Okay.
I want to say gentlemen, but it's plural.